Welcome to ICUDemy, the educational channel of the Critical Care Society of Kenya. In this session on respiratory mechanics, we will focus on compliance. Compliance is defined as the change in volume per unit change in pressure. Its units are cubic centimeters per centimeter of water. In simpler terms, it reflects how easily the lungs expand in response to pressure. It's important not to confuse compliance with elastance. Elastance is the inverse. It describes the lung's tendency to recoil to its original shape after being stretched. The total respiratory system compliance is derived from the lung and chest wall compliances. Each of these structures has a compliance of 200 cubic milliliters per centimeter of water. Since the lung and chest wall are in series, we calculate total compliance using the reciprocal formula. Substituting the values, we get 1 over 200 plus 1 over 200, which equals 2 over 200, or 1 over 100. Therefore, the total respiratory system compliance is 100 milliliters per centimeter of water in ideal settings. During volume preset mechanical ventilation, compliance is calculated using the tidal volume divided by the difference between plateau pressure and PEEP. Compliance in healthy lungs in the erect position is approximately 1 cubic centimeter per kilogram of predicted body weight. For example, if the predicted body weight is 70 kilograms, the lungs should expand by 70 cubic centimeters for every 1 centimeter of water increase in pressure. In clinical settings, we generally consider anything above 60% of this predicted value to be acceptable. Note that compliance measurement assumes single compartment mechanics, which often underestimate the complexity of regional compliances in situations with great inhomogeneity, such as acute respiratory distress syndrome. Let's visualize compliance using a pressure-volume curve. We plot pressure in centimeters of water along the x-axis and volume in cubic centimeters along the y-axis. This sigmoidal curve represents how lung compliance varies with lung volume. It's characteristic of how the lungs behave during inflation, initially stiff, then more compliant, and finally stiff again as they approach maximum capacity. Let's explore this curve in more detail. The white dot moves along the curve, and the colored lines represent the change in volume over the change in pressure, which is compliance. As we move the dot along the curve, notice how the slope changes. At the left, the slope is nearly flat, indicating low compliance. In the middle, the slope is more steep, indicating normal compliance. And at the right, the slope becomes nearly flat again, indicating low compliance due to overdistension. At the lower end of the curve, compliance is low. This is typically due to alveolar collapse, also known as atelectasis, which occurs at low lung volumes. In the middle region, compliance is normal. This is the optimal zone for ventilation. And at the upper end of the curve, compliance is again low. This is due to overdistension, which occurs at high lung volumes. Understanding this curve is essential in mechanical ventilation. Both low and high compliance states carry risks, from collapse to overdistension. Targeting the region of optimal compliance is key to lung protective strategies. Thanks for watching.